For those of you who I've not met previously or have not been on one of the SBO webinars previously, my name is Matt Mayhood. I am the president and CEO of the Silicon Valley organization, and it's great to have you with us this morning. In just a few minutes, we're going to hear from Kaiser Permanente, a long-standing SBO member, and we're going to hear from two of their workforce health consultants who will share return-to-place strategies, guidance around health considerations, and how to keep your workforce safe and healthy during this very challenging time. To keep our virtual networking going, we encourage you to type your name and your company and your contact information in the chat box. And if you see somebody there who you want to get connected with, you want to meet or talk a little bit more, feel free to chat directly with that individual or to contact that individual. A quick update as to what's going on here at the SBO. Even though we're all still working remotely outside of the SBO World Headquarters, our staff is still working hard on your behalf. We continue to work with local and community leaders to make sure that we open our economy in a safe and I would say appropriate manner. Even we got some great news yesterday where we get to continue to open up our economy here in Santa Clara County. We're moving into a new direction, even though we have had an increased number of infections in Santa Clara County. We continue to do a great job because our residents in Santa Clara County are smart. They're wearing their masks, they're washing their hands, and they're social distancing. So let's keep doing that. We can keep opening up our economy, and we can really try to keep those infection rates down as low as possible, and we can get our economy back to work, which we so desperately need, especially those small businesses. I do serve on the Mayor's Regional Recovery Task Force, and we are working as a region with other CEOs and community and business-based leaders to find ways that government can help businesses open up their businesses quickly and support businesses open up, and also making sure that longer term that we have an economy that works really for the majority of our residents here in Silicon Valley. If you are continuing to look for resources for your business, I encourage you to go to the SBO website at thesbo.com. We have a COVID-19 resource page, and it's updated daily. And I know that we just put up some new information with the county's most recent health directive that just came out yesterday that takes effect on Monday. So go check that out. All right. So before we get started, I got one more thing that I would like to do, and that is I want to thank the SBO community builders. We are a membership-based organization, and it is through their ongoing support and engagement that we continue to be a catalyst for business growth, a convener of leaders and influencers, and a champion for a stronger community. We are driven by a fundamental belief that when businesses succeed, our communities thrive. And that will tell you that that is being put to a test right now because without businesses being open, many of our residents are struggling without having jobs, not being able to pay their rent. So we need to make sure we get our economy open, the businesses succeed, and our communities continue to thrive. So with that, if you are not a member of the SBO, I encourage you to learn more and check it out. There are lots of ways you can get engaged with us. And if you want to learn more, hit me up in the chat box, hit Monique New up in the chat box, and we can tell you more about that. So a couple little housekeeping things. Our meeting will be recorded and we will share it by the end of day on our website. All meeting participants are muted upon entry, and if you have questions that you would like us to consider later in the presentation, we would ask that you post those into the chat box. Our presenters really cannot answer specific questions that relates to medical, clinical type questions, legal or policy, but they will tell you more about the questions that they can answer. But if you have any questions, put them into the chat box and we'll try to get to them during the Q&A. All right, so getting back to today's webinar, we're happy to have Kaiser Permanente with us today. They've been a member of the SBO for over 50 years. And as mentioned, on Monday, July 13th, more businesses will be allowed to open following the state approval yesterday. So it's perfect timing to have this webinar to keep your employees healthy and safe as they return to work and keep your patrons, your customers, safe as well. So Kaiser Permanente, they've developed a free downloadable playbook that includes tools to make your workplace safe and how to support your employees. And we can PDF a copy of that playbook after the webinar. So with that, I'm going to shut up. I'm going to stop talking, and I'm going to turn it over to our subject matter experts, Dana and Joan, and they are workforce health consultants with Kaiser Permanente. So Dana and Joan, thank you very much for being here with us today, and take it away.
Great, thank you so much, Matt. And welcome everyone. We're so thrilled to be here with you today. I'm going to go ahead and just turn off my camera at this point as we advance. But before doing so, I just want to quickly introduce myself. My name is Joan Salemi. I'm a senior workforce health consultant, and I'm joined by my colleague, Dana. Dana, you might want to just wave.
Just wave. Hello, everyone.
Dana is also a workforce health consultant. We both work in the Oakland area here in Northern California. So we're so thrilled to be here. And as I said, I'm going to go ahead and turn off my camera and we'll jump into the presentation. So Mo, would you mind advancing? And maybe, there we go. Thank you. So this playbook is actually meant to offer useful tools for employers to make their workplace as safe as possible and to support the employees. It includes, number one, a framework outlining the various dimensions of health to consider in this post-COVID-19 era. Two, it includes guidance, recommendations, curated tools, and resources on how to safely restart work. And three, it includes information on Kaiser's clinical services and member resources. Because the playbook is now over 100 pages, we encourage you to focus on the chapters that are most relevant to your industry and your workplace. And please keep in mind, this document will be updated regularly as science and information evolves. And Mo, we can advance. So as you can see from the table of contents, the playbook is organized into chapters, and each chapter has a different focus. As you can also see, the playbook is fairly comprehensive, addressing various dimensions of health. Next slide. We know COVID-19 and the shelter-in-place order has significantly impacted physical, mental, and social health. This framework was developed to help employers think about and address the various health dimensions in planning for what's next. For example, under the category of physical health, employers will need to consider workplace safety as well as testing and return to work policies. It's also important that employers consider the mental and social needs of their employees. Experts are anticipating a surge in mental health symptoms, which may coincide with the timing of returning to work. Building or reinforcing a psychologically healthy workplace where employees feel safe, respected, and empowered is more important than ever. Employers should also focus on where their employees live and their ability to meet their own basic needs, such as food, housing, job security. These factors will impact employee health and productivity at work. So next slide. And at this point, I'm going to turn the conversation over to my colleague, Dana, who will lead us through the next several slides.
Thank you, Joan. As we review these sections, we can get a feel for how the playbook is laid out. We're just looking at each portion, or a portion of each of these chapters, to give you an idea of what's contained within. I'll spend a little bit more time talking about safety around employees, because that is something people are very concerned about. And each chapter, you're going to find an overview of the issue, some market information, guidance from leading agencies, namely the CDC and OSHA, and a list of resources. This information can get out of date very quickly, so always feel comfortable reaching out to your Kaiser Permanente representative to get the most current version. If you don't have a relationship with Kaiser Permanente, please know that an updated version of this playbook will be available online anytime you need to reference it. And we're providing updates about every 2 weeks, adding additional information. And there's also online a survey where if there's something not in there that you'd like to have in there, we ask that you create that response, and that's on our website. The COVID workplace will look very different than pre-COVID. It will be an adjustment that requires everyone's buy-in, but it is critical in ensuring all employees and their families remain healthy and safe. The changes you make are in alignment with a majority of employers. And you'll see that in a recent Mercer survey on COVID-19, the vast majority of nearly 500 US employers that responded are taking action to protect their workforce, like enhancing cleaning and disinfecting and providing masks. You aren't alone in this. Additionally, according to the same survey, about a third of employers are planning to perform some type of health screening on site. And as you think about your workforce and work environment, consider what makes sense for you and your employees. We recommend continuing remote work arrangements whenever possible to reduce the potential risk of infection between employees and with customers. The focus of your safety plan changes should surround three main categories, which we'll dive into deeper. First, employee sanitation. Second, environmental sanitation. And third, containment strategies. We need to remember that coronavirus remains a highly contagious virus, and strategies to reopen the workplace should focus on mitigating risk and exposure. Next slide, please. Guidelines for a safe work environment are tailored by industry. However, all industries have similarities, which include communicating the importance of the following health and safety guidelines clearly. Be clear in your expectations of employee sanitation behaviors, like physical distancing, hand sanitation, respiratory etiquette, and personal protective equipment. Ensure that you provide the infrastructure needed to support these expectations, like having enough sanitation supplies on hand. Be clear in what you're doing to ensure a safe work environment, including environmental sanitation, and what your expectations are for employees, such as how frequently are you sanitizing the workplace? What is being cleaned? Do you expect people to wipe down their workspaces each day before they start working? Will you be supplying cleaning wipes for employees? And how are you setting up workplaces to ensure physical distancing? And you'll want to train staff on sickness containment processes. Ensure policies are not punitive for taking off sick time. What should employees do if they start to show symptoms? And who needs to be trained in contact tracing? Next slide, please. When thinking about employee sanitation guidelines, it's important to think about what personal protective equipment is needed for your workforce. PPE in a manufacturing plant looks different than an office setting. So you'll want to define what it is for your setting and ensure that you have a supply chain secured before reopening your business. Be clear about expectations for personal sanitation behaviors. For example, it's one thing to say wash hands frequently versus wash hands frequently for at least 20 seconds, and especially after touching boxes and being in the break room. And whenever possible, use visuals and be explicit. I came into the office yesterday to print some things, and I noticed all the signage in the lunchroom and in the bathroom about one person being in there, the sign above the sink on how to wash my hands, even though I should know how to do that by now, but it's having these visual reminders that really makes the impact, including things like a sticker on the floor showing 6 feet in the bathroom away from someone else. Also be clear about what respiratory etiquette is and how important it is for the health of everyone. You can set up your workstations with adequate spacing between each station. And as Matt mentioned before, instituting universal masking when possible, it really does work. And prohibiting large gatherings and limiting gatherings to less than 10 people. So if you're having a meeting, even if you're in the workplace, it might be better to do it from your desk versus in a conference room where you're close to each other. Place tissues and trash receptacles throughout the workplace and stay up to date on the latest CDC guidelines to ensure the safest workplace hygiene. Next slide, please. Since the coronavirus spreads predominantly by infected persons' droplets of fluids released into the air or on surfaces, A well-ventilated workspace can help to minimize exposure. Allowing fresh air from outside into the workplace with a coupling of vigilant cleaning and disinfecting can reduce the spread of risk. Next slide. There are many options to implement contact tracing. We hear some countries like Thailand are using cell phone GPS tracking for an automatic way to track people where they are. If they need to constitute contact tracing, I'm not sure our country is ready for that because that can be kind of extreme. There are phone apps and technologies to use in that space. Many are being developed right in Silicon Valley. So you could institute something drastic or as simple as having people track their movements throughout the day in case the data is needed. Either way, you'll want to strongly consider the implementation of contact tracing to limit exposure should you need to trace an infection in your workplace. Right now, the state of California is hiring contact tracers, hoping to have up to 20,000 hired on. Ensure that sick day policies are not punitive, and we can learn from the Smithfield meat plant that policies to reward and encourage no sick days, although implemented with good intention, backfired and resulted in a full shutdown. Next slide, please. During this time of uncertainty, the importance of frequent communications cannot be overstated. As with any new protocols, frequent and repetitive communications will be critical to support employees to conform to new procedures. Additionally, you will have employees who may be under additional pressure outside of work, such as struggling with family and friends who have been impacted, worried about performing well at work, becoming the only person to provide for the family. They need to feel supported at work and know that their employer cares for them and has put additional protocols in place for their safety. Campaigns should be multi-layered to include specific steps they need to take. For example, focusing on hand hygiene, or where do they go for more information, such as their managers or a website that will be updated regularly. And using multiple methods to communicate is really important: signs, emails, texts, and meetings. And if you have a represented workforce, be sure to coordinate and communicate with your labor representatives and leadership. Next slide, please. To reduce the potential risk of infection between employees and customers, as I mentioned previously, consider having your remote work arrangements whenever possible. And Kaiser has implemented into this playbook some of our own information about work from home for employees, for managers, and video tips for working at home and setting up your space. Probably by now, people are starting to notice some ergonomic issues, and so it's a great time to kind of provide some information about that as well. Next slide, please. The playbook also contains a workplace safety checklist, and you can see some of these items here to look at. I won't read through them all as you'll have access to this, but it's really important to consider these many areas. And in workforce health, Joan and I work with a lot of customers, and one of the things that we focus on is combining wellness with safety. And so if you have a safety committee or you're considering a safety committee, bringing in those people to help prepare the workplace and to set up these protocols is really important. Next slide, please. And I just wanted to show you this robust listing of workplace safety resources that are contained in the playbook. This includes video information, fact sheets, and posters that you can display in your workplace from the CDC and OSHA to help you set up your workplace. Next slide, please. In Chapter 2, the playbook covers testing and returning to work safely. We saw the government initiate some of the rules around sick leaves through the Families First Coronavirus Response Act, or FFCRA, which requires employers with fewer than 500 employees to provide paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. It also means that if you do not fall under this new regulation, you should be looking at supporting employees that call in sick. Do you have an emergency sick leave at this time, during this time? And how flexible are these policies for leaves? Once the employee returns, what are the expectations? And one idea is to set up a call with your employees who are going to be returning to work, letting them know what type of changes they will expect. And managers and supervisors, they are your frontline staff fielding the questions, anxieties, and concerns. Make sure that you offer them guidance through this back to work process. They could be daily huddles or quick check-ins, supporting them on how best to meet their employees' needs. Understanding that productivity will look different and everyone is in a learning mode. This is all new territory for us. Next slide, please. The playbook offers guidance based on CDC guidelines for return to work for employees with and without symptoms, including timing on when employees should be returning back to work. So you can see those with symptoms, those without symptoms, if you're using a time-based strategy or a symptom-based strategy. And you'll see there's a, down at the bottom is the CDC source, which will always have the latest information. Next slide, please. To help with testing priorities and keeping workplaces safe, establish or update your leave management or return to work guidelines that include employee self-reporting of symptoms, appropriate testing, and medical documentation. This slide or page in the book prioritizes groups that need testing and provides links for the latest information on care and testing from Kaiser. It also includes a link from the CDC on evaluating and testing persons for COVID-19. Next slide. All right, some screening guidance. So temperature taking is permitted by employers during this time, whether it is self-reported, which is preferred, or taken at the door before starting work. As an employer, you can take an employee's temperature as long as all employees are subject to the same process. If someone calls in sick, you can ask specifics about their symptoms as they relate to COVID-19 only, like, are you experiencing influenza-like symptoms such as fever or chills and cough or sore throat? And most importantly, if you are tracking any of this information, it will need to be kept in a separate file as part of the employee's medical information and not part of their personnel file. You should follow the same guidance used for ADA requests. There are comprehensive guidelines in the latest version of the playbook for on-site temperature screening. And just a little fact is that a temperature greater than 100.4 is considered high. Next slide, please. Now, testing is one of the criteria for safely opening, and through current antibody studies, we know that we need more testing to have a realistic view of the spread of the virus in our community. But antibody tests are really useful for showing us how disease is behaving and spreading in a population, but they are not useful in making decisions about individuals. And there's many reasons for this, but first of all, the antibody tests that are available are not very good. And only a few dozen of the tests that are being used have been approved by the FDA. And even these are not nearly perfect. So in a population like ours that has a very low prevalence of disease, in Santa Clara, according to a recent survey, about 5% of the population has been impacted. A very large percentage of the positive tests would be false positives, and we wouldn't know which ones those are. So we would be telling people that they're positive when they aren't, and they'd believe that they're immune to the virus and protected when they aren't. They could then go on to infect themselves and other vulnerable people that they're in contact with. And in addition, you can test positive on an antibody test at the same time that you have an active COVID infection. So we also really don't know what a true positive test even means. So just because you have antibodies against a virus, it doesn't mean that you're immune to it. And for example, we could look to HIV, that people with HIV make a lot of great antibodies against the virus, but these don't do anything to clear the infection or protect them. And it would be reckless right now to use antibody testing to make decisions about individuals. Next slide, please. Chapter 2 contains information about various workplace scenarios with the situation, COVID, documentation issued by Kaiser, and how employees can, or members can obtain that documentation. And our medical teams at Kaiser are working diligently to treat and care for our members, including providing timely and accurate medical documentation to support employees who may need to take a leave of absence or modify their work arrangements. Understanding what to expect with respect to letters, notes, and certification as you reach out to your employees will help you, your employees, and their physicians during these times. Screening and return to work policies are continuing to evolve, and as we learn more about the disease, be prepared to monitor and update your policies as necessary. Now I'd like to transition back over to Joan to take us through the next few chapters.
Thank you, Dana. And Mo, if we could advance to the next slide, please. Great. Although the physical safety of your employees and your workplace are top of mind, employers cannot ignore the mental and emotional impact of COVID-19 on the workplace. Chapter 3 outlines actions you can take to address a potential surge in mental health symptoms that may coincide with the timing of returning to work. It gives information on how Kaiser Permanente can support you with clinical and workforce health resources. We've also developed a mental health and wellness webinar series exploring the impact of COVID-19 on the mental health and well-being of your workforce. Next slide. Mental health is on a continuum. While some employees have serious mental health conditions that require long-term clinical treatment, others may benefit from short-term interventions or subclinical tools and resources. At Kaiser Permanente, the type of care we provide depends on clinical guidelines and best practices, along with individual needs and goals. On your screen is a list of self-care and specialty mental health services that we offer. And of most of our mental health services are currently being provided successfully through televisits. I want to specifically call out 2 new apps that are now available at no cost to Kaiser Permanente members, My Strength and Calm. Now, My Strength is a cognitive behavior therapy app that we've used in a clinical setting for nearly 2 years, along with other tools. Kaiser Permanente is now offering My Strength at no cost to adult members. And Calm is the #1 app for meditation and sleep. It's designed specifically to help lower stress, reduce anxiety, and more. It's also available to Kaiser Permanente members at no cost. And you can access these at Kaiser's website. The URL is www.kp.org/selfcareapps. Next slide, please. So chapter 4 really focuses on social drivers of health. And the key takeaways from this chapter would include addressing the social and economic needs of the entire workforce, considering ways to help communities where your employees live and where your business is located, and then finally to remember that Kaiser's telehealth and culturally responsible care benefits everyone, especially your more vulnerable workers. Next slide. So this is an interesting slide where we really look at health outcomes and how various factors can influence an individual's personal health outcome. So when we consider individual health outcomes, we know that social drivers of health account for about 40%, which you see at the very top in red. And these can impact both employee health and business productivity. These social and economic factors play a huge role in an individual's ability to meet everyday demands like food, housing, and transportation. So what matters more than healthcare? Number 1, social drivers of health are conditions in which people live, work, and play. There are things outside of the doctor's office that can really impact one's health. For example, do employees live in a high-density housing area where it's difficult to socially distance or self-isolate if they have COVID-19 symptoms? Do employees live in neighborhoods with limited access to fresh fruit and vegetables in order to maintain healthy eating and sleeping habits? Or finally, do community conditions exacerbate underlying health conditions which could put certain individuals at greater risk for COVID-19 complications? And then we also want to consider the social and economic factors that people need in order to meet everyday demands of life. The ability to pay bills or the necessity of taking public transportation to work may impact an individual's focus at work and overall business productivity. Affordable and safe childcare will be top of mind for employees as they return to the workplace. And then when we think about furloughed or laid off employees, they too may be experiencing significant financial strain, as well as low-wage earners who are particularly vulnerable. And then finally, when we think about unmet food, housing, and other social needs that may become more acute during this period, especially for employees who were struggling to meet these needs before COVID-19. We anticipate that many employees will have to prioritize their social needs over their health care, which can be particularly concerning for people with chronic conditions. Next slide. So in Chapter 5, our focus is on HR policies. And again, the key takeaways within this chapter will be that HR departments have a unique role in supporting the employees during this time of uncertainty, change, economic challenges, and physical distancing. And we really want to remind you to take advantage of local and national government policies, which will help mitigate the impacts of COVID-19. Next slide. HR policies, plan documents, and protocols will also have a significant influence on assuring that your people are prepared and supported during these challenges. Being prepared and really thoughtful regarding these matters will help your workers develop a greater capacity to be present at work and to help you meet the pressing business challenges. This slide that you're looking at right now illustrates several of the key areas to focus on, and we've divided it into two categories, as you can see. So we have benefit plans, and then we also have HR policies and protocols. Next slide. So you may need to rethink your current mode of communication with employees. It may be that new channels are required, or perhaps aligning communications with your labor partners. And as Dana said earlier in her portion of the presentation, repetition is key. You really want to communicate frequently with your employees. People are distracted by many demands that they have on them at this particular time. So remember to be patient with your employees and look for easy ways to help them find information that's relevant to their particular situation. Next slide. So Chapter 6 within the playbook is focused on legislative guidance. There are a variety of changes to federal, state, and local regulations that are being implemented in response to COVID-19. And as I'm sure you can imagine, these regulations are so fluid. It feels as though they're changing weekly. So we've collected a number of resources to help you access the information and inform your own planning, but do keep in mind that our playbook will continue to be updated as these regulations are updated. Next slide. Chapter 7. Chapter 7 is focused on industry spotlights. We also thought it would be very helpful to highlight specific resources for industries with unique requirements related to COVID-19. In our playbook, you'll find pages dedicated to some of the unique challenges faced in returning to the workplace for industries that you see listed here. Next slide. So this is an example of the content that is included within the chapter. You see on this slide, we've focused our attention on manufacturing guidance and considerations and areas that really could be focused upon to help reduce risk of the exposure of the virus. And then on the next slide, we've listed out corresponding industry resources. And so you'll find this throughout this particular chapter. And next slide. The COVID-19 pandemic isn't just a public health concern, it's an economic challenge too. During this time of unprecedented change and financial disruption, we understand that navigating the coverage and cost of your healthcare might be difficult. And as you work towards supporting the health of your workforce, whether you're continuing with your current coverage or seeking another plan to better fit the needs of your business, we'd like to make one thing clear, and that is that we are here for you. And we want to help you to be there for your employees. Right now, your employees have a wide range of services that help ensure that they can continue getting the high quality care and coverage they've come to expect from Kaiser. Our comprehensive approach makes it easy for them to understand their coverage situation, learn more about their options, and ultimately choose the right plan for them and their family. As a business owner, you have access to online and live resources to help you stay informed and support your workforce, both during these times and after we get through them. For employees, we can really help them benefit through several different venues. First, whether your employees are at risk for layoffs and furloughs or have recently lost their health coverage, Kaiser proactively can contact them with letters, emails, and phone calls to provide resources and guidance that can help them stay covered. Next, to support their coverage options and to learn how to apply for financial help, your employees can use our continuing coverage online tools at kp.org/explore options. And then finally, for additional help understanding their coverage options, employees can call Kaiser Permanente healthcare specialist. Our representatives are available 24 hours, 7 days a week on our member service lines that are trained to connect employees with the resources that they need. As business owners, you can take advantage of our live and recorded webinars. Now, these interactive forums share information and answer questions about healthcare coverage and benefits. As the situation around the coronavirus evolves, we're also diligently working to provide webinars specific to COVID-19 to discuss the latest symptoms and testing updates to help you learn how to continue getting care, your employees can continue getting care safely, and to keep you aware of updates that could impact your employees. We also offer an on-demand resource library, which is filled with tools, tips, and resources that are available for download right now at kp.org/choosebetter. These on-demand and entirely free resources to all business owners looking for an easy way to share information and support the health of their workforce. For more information, you can go to the URL that you see at the bottom of this slide, business.kp.org/coronavirus. Next slide. So we'd like to pause for a moment and ask you to pull out your phones and hold the camera up to the QR code here. We'd really like to ask that you please take the survey that will pop up. This helps Dana, I, and all of our colleagues at Kaiser assess how we're doing and how the content of today's presentation resonated with you. And it also gives you an opportunity to provide us feedback regarding other areas that you would like information on. So again, if you don't mind just taking a quick moment, we would greatly appreciate it. And Monique, we can probably advance to the next slide. I just want to remind everyone that the purpose of this playbook is to provide information, but it should not be viewed as a comprehensive instructional guide. As the pandemic evolves, we encourage you to continue to seek guidance from the CDC, your local Department of Health, and any other local and national agencies. And Monique, if we could advance one more slide, that will lead us to our Q&A portion. And one more slide, please. So prior to today's presentation, we actually received several questions, and we wanted to highlight some of those that seem to be bubbling up to the top. So on this slide, you'll see that we've listed a few of the questions that we wanted to discuss today, and Dana and I will quickly run through the first ones that we see here. So Dana, would you like to take question number 1?
Sure. Thank you, Jen. Yes, so the first question is how is KP handling the increase in the need for mental health services due to COVID-19? And we've definitely seen an uptick in our mental health services and our patients. And we've been providing nearly 100% of our behavioral health care through telemedicine, visits either by video or by phone. And to aid this process, we've eliminated the use of all written forms and are administering necessary screening tools via kp.org or verbally with the member. And what we're finding is we're completing more visits than ever before because we've seen a reduction in no-shows since we've moved to virtual care. And I'll also just reinforce the MyStrength and the Calm apps that we've actually tripled the number of enrollments in MyStrength that we were expecting by the end of the year and doubled Calm. And those just started to be offered in March for MyStrength and then in May for Calm. So people are finding that those digital self-care tools are really helping them with anxiety, depression, and sleep. Joan, would you like to take the next question?
Great, thank you, Dana. Yes, so this question reads, when should I direct my employees to get tested for COVID-19? And so my response would be, most people who become infected with COVID-19 have mild symptoms and don't need to be tested. The CDC has very specific guidelines for who should and who should not be tested. And at Kaiser, we follow these CDC protocols. And while we have enough tests for members who need them, and we're working hard to increase our supply, there is still a nationwide shortage. It's essential to continue testing responsibly in all settings, so reliable tests are available for the people who truly do need them. It's also important to remember that tests should come from a trusted source, and Dana somewhat alluded to that earlier in the presentation. If an employee needs testing, we're here for them. At Kaiser Permanente, we use tests that are approved by the FDA. Plus, we can connect employees to the care they need if they test positive. There are extra steps for your employees if they use a third-party vendor. The vendor can only administer the test, so your employee will have to connect with a doctor on what to do next. I think I'll go ahead and just take the next question, and that reads, as we return to work, what are the most important things for me to do to protect my employees? And you know, this is a question that I think Dana and I are fielding almost daily from the clients that we work with. And there are a few best practices that we would really like to recommend. So as your employees are returning to work, I would recommend that you institute a universal masking policy. You want to provide at least 2 arms length between workstations. Think about ways you can increase ventilation and air circulation. And that would also include cleaning the filters within your air circulation system. Regularly disinfecting, frequently touched surfaces. So think about the areas where employees will be moving and congregating throughout their day and create some sort of a schedule so you can ensure that those areas are cleaned regularly. And regularly is a little bit elusive, so that could be hourly, it might be 3 or 4 times a day, but you want to make sure that those spaces stay clean. And then you also want to educate your employees about things like proper hand washing and other precautions that they can take, what to do if they have symptoms of COVID-19, and you also want to ensure that everybody is well aware of the sick day policies and procedures. The next question that we're showing here states, what is recommended practice for employees returning from a trip using air travel? Should they self-quarantine for 14 days or 72 hours? So again, this is a question that is coming up quite a bit. As you know, in California, we don't have a policy requiring self-quarantine for 14 days, but many other states have implemented this policy. Given the fact that we don't have an order, I would say you probably want to use your best judgment, and if necessary, you may want to seek advice from your attorneys. But we really can't give you any further guidance than just use your best judgment. The next question, Dana, if you don't mind, I'll toss this one over to you so I can read it for you. What protocols do you recommend for shared spaces?
Okay, so for kitchens and conference rooms, one thing that I wanted to mention is that in future versions of the playbook, we're going to be providing some visual guidance for, high traffic areas. But if you think about the kitchen, you want to have a sign on the outside of the kitchen saying how many people could share that space. In the kitchen at Kaiser that I use, even though it's about 20 feet long by 10 feet wide, the recommendation is one person because of the smallness of the hall getting there in the doorway. So some other things that you'll want to think about are the high touch surfaces like refrigerators, microwaves, the water cooler, coffee pot, maybe moving to, we still have to have our caffeine, but maybe figuring out single-use protocols, or on our water machine, they've installed those antimicrobial buttons that they put on, as well as the elevator. Also having hand sanitizers available, and maybe moving some tables out of your break room and maybe having just one chair at the table in the break room. So those are all things that are coming down the pike, but just kind of think about your own home. What are the things people are touching? Doorknobs, light switches, those kind of things. In the building that I work in, they've got the front doors open. They have one way to enter and one way to exit. And so that additional air is helping to purify the spaces. In terms of conference rooms, I really think having meetings like that in a conference room, unless it's very large, is something that we should probably wait for until the virus is a little bit more controlled. So that is all of the questions that we have prepared. I just got to look in the chat and see if there's anything else, or Matt, if you've seen anything else that looks interesting to answer.
Hi. I haven't seen any questions really come across other than some comments about great information, to be honest with you. I think you guys did a phenomenal job, and somebody asked if this will be available later today, or the slides will be available, but both the slides and the entire webinar and the playbook will be posted on our website later today. So it will be available by end of day, usually, if we got our act together. We get it end of the day. But Dana and Joan, that's been great.
Thank you.
There was a question just came across. If you do not recommend test when positive, when do you recommend when you have a COVID outbreak at work?
A test when positive.
I think I would probably pivot a little bit in my response, and I would just ensure that the policy regarding anybody who is symptomatic is really broadly communicated. So if somebody feels that they are coming down with symptoms, we want to encourage them not to come to work, and making sure that they're well aware of the sick policy. I think the gray area, the area where we kind of get into, we have challenges, is when somebody is asymptomatic. And again, trying to determine what exactly is that. Sometimes what I'm hearing now is that it's rare that somebody is asymptomatic. They might have mild symptoms, but it's rare that they are actually asymptomatic. So I think, again, trying to think through what policies are appropriate for the workforce and what kind of communications do you want to convey.
Okay. So I don't see any other questions in the chat box.
Yeah.
Which means that Dana and Joni did a really great job providing all that information.
Thank you so much.
Somebody had a question. Are there any ready-made signs for office protocol that they can post in a shared building?
Yes, actually, a couple of the slides that I went through have I can't remember which slide number it is, but there was one that had OSHA and CDC. They were specific signs you could just print off and put in your workspace. So those are available in the playbook. Let's see if I can find the
awesome.
page. Yeah.
I also know in the we have a link to some in our COVID-19 resource page as well. There's some links to some resources there.
Yeah, it was page, the first chapter, page 15, has those things that you can just print off and use in your workspace.
Awesome. Okay. Well, I don't see any other questions coming through. So Dana and Joan, great job. Really appreciate it. Standing ovation to you guys for this morning, and to Kaiser Permanente for putting together the playbook and the information and the PowerPoint today. So thank you very much for being here with us. Really appreciate it.
Our pleasure. Thank you very much. Enjoy your day and stay safe.
Thank you.
Wear that mask.
Yes.
Everyone who's logged on this morning, we thank you for tuning in and being with us. We continue to advocate for a safe reopening, and if you have any questions, comments, concerns, or you need clarity for your business, please don't hesitate to reach out to us, to the SVO team. There's a way you can do that on our webpage, so feel free to do that. You know, we're here to help you, so let us know how we can help you and what information or tools you might need. Join us next Tuesday at 10 a.m. We're going to hear from SVO members Hogue Fenton, Frank Rimmerman and Company, and Bazzuto Insurance. They're going to provide some information on PPP loan forgiveness and provide additional return to work guidance. If you want more information, go to thesvo.com. So let's go out there. Let's continue to work. Practice good social, physical distancing, wash your hands, and wear a mask when you're outside and in somebody's business. And we look forward to seeing you soon. Have a healthy and a prosperous day. Thank you very much for being with us. Bye-bye.